us for this very special episode of Amigas, we have a really special guest. Why don't you introduce him?
The famous, world-recognized Dr. Ozan Sozer.
With the Amigas.
I like it. Amigas, I like it. Welcome. Dr. Sozer is a board-certified plastic surgeon.
Yeah.
He's also Maria Elena, who's also a physician, her husband. Now, first of all, and I heard this the other day, explain to us the difference between a plastic surgeon and a cosmetic surgeon. I didn't. The other day, someone told me you better be careful. I was like, "Oh, let everyone know what's important about this."
To be a plastic surgeon, you have to do certain years of residency. You can go after medical school directly in plastic surgery. It's a 6-year program, or you can do ophthalmology, orthopedics, general surgery. Do your residency, ENT, and after that, do plastic surgery residency. You become a plastic surgeon. The cosmetic surgeon, usually none of those specialties, and or somebody who wants to do cosmetic surgery wants to do a shortcut. And so basically, there is no official plastic surgery training. Maybe they take some courses. Somebody offers a cosmetic surgery fellowship for 1 year. And so they cannot say they are plastic surgeon because they are not. So they have to come up with a title. So it's a cosmetic surgeon. And not necessarily all of them are surgeons.
Right. That's the key.
Yeah.
Not all of them are surgeons. They do a course.
Yes.
Cosmetic versus plastic, right? I didn't know this.
Yes.
It's very interesting,
right?
And they even have their own societies. But like Board of Plastic Surgery is a recognized board. It is, American Board of Specialties recognizes plastic surgery. Cosmetic surgery is not recognized.
Yeah.
So, but, you can have your own association. Everybody can have associations and members, and there are many of them. But that's what it is, the difference between plastic surgery and cosmetic.
And I think in United States it's not officially like they're cosmetic surgeons. They do courses, but in Europe they do like a year or two of cosmetic surgery, and they practice as a cosmetic surgeon. Am I right?
I'm not sure what happens in Europe, but mostly what is happening in the United States, even like many years ago when I came to El Paso, there was a doctor. Actually, he was an internist, and he was doing liposuction, and he was doing under local because no cosmetic surgeon will have hospital privileges to do liposuction, and they cannot have their own surgery center. They are not allowed. So the only way they could do it under local.
That's why, and I'm not going to name names, but I've known some doctors. I don't even know if they're surgeons, doctors who are doing procedures under sedation and not general. And I didn't understand that.
Neither did I.
Even IV sedation, they require some sort of certification. If you are not a surgeon, you will only qualify oral sedation and just local anesthesia.
So you really want to do your research, whatever you're going to do. I mean, someone that's, look them up. They're a surgeon trained.
What can you look at when you are trying to interview as a patient, your doctors, to make sure that they're the correct doctor to pick?
I think nowadays everybody knows they have to look for a board-certified plastic surgeon. And also, if it comes to facial surgery, there is a facial surgery specialty. They are usually ear, nose, throat, and they are good. They are very well trained. They do go through ear, nose, throat training, and they do 1 year, 2 years of facial plastic surgery practice fellowship, and they are very qualified. So if you're going to have facial surgery, you look for board-certified facial plastic surgeon or board-certified plastic surgeon. You have body or breast surgery, just you look for a board-certified plastic surgeon. And you can go to the website of American Board of Plastic Surgery, you will see the list of surgeons that are certified.
So let's talk surgery now, and it's all the rage, which is my favorite subject. So we've done shows on injectables. When is it time? When do you tell your patients, okay, injectables will fix this, Botox filler, and now you need surgery?
I mean, to me, of course, I may be biased, but earlier it is better. Number one, earlier surgery is less aggressive. And also, you want to enjoy a younger looking face, is that right? Or younger looking body. You want to start enjoying it when you're 70?
No, that's actually the point.
Why don't you start enjoying it when you're 45 or 50?
Someone wouldn't even enjoy.
Or also, I would assume that if you make a change at like 70, it's such a drastic change in your face that's when people are like, oh, you look so different.
You cannot even have a lover because they see your ID and you're like,
It's true. But so are you getting younger and younger patients, or what's the most procedure that people ask the most and younger patients?
Younger, actually, now facial plastic surgery, when I started my practice, was only for the wealthier or like Hollywood stars or something like that. People wouldn't think about it, okay?
Yeah.
But now we're getting 23-year-old, 25-year-old. That social media made everybody conscious about their look. And when a 23-year-old comes to you, they want neck surgery. And it is not uncommon, actually. If you have this bone is small, you will never have a very crisp jawline all your life. And these 23-year-old, 25-year-old, they see on internet all these sharp-looking jawlines, and they look at the mirror and they say, why don't I have that? And now it's an anatomical problem, and it is possible to do a surgery and give them that. So that is one group. The second group is now they are looking into beautification surgery. They are not necessarily trying to look younger. It is like having a rhinoplasty or breast augmentation. You want to change your face a little bit. You want higher cheekbones, sexier or exotic looking eyes. That's another younger group. They are having facial plastic surgery. Then just regular facelift, now it is significantly more acceptable. 45 and over, they are having facelift surgery now earlier in life.
So I have a question. I remember, growing up and meeting different people and seeing different people getting plastic surgery, like facelifts. I remember working with some people and they would do it like up here. Like I've seen like
I was saying endoscopy.
No. That's a forehead lift.
Oh, okay.
Okay, so it's like to elevate the brows so many years ago, they used to do coronal cuts from here to here.
Yeah.
And so it was hidden. But one disadvantage is going to move your hairline upwards, especially if somebody has a higher hairline.
Now imagine me doing the cross on the signs. Por las...
No, when you say padre,
the name of the
Yeah. Yeah, I mean, nowadays nobody does coronal cuts. Almost nobody.
So technology has advanced in science.
Yeah.
And so
The techniques.
where does it hide, or how do you...
I mean,
When I see people, like,
really hide it.
Yeah, talk about your...
I mean, if you're a younger patient, you can do a endoscopic faces, or the procedure I do is called glide lift. You can do it with an incision into the hair, but it has to be a patient with no excess skin, because that procedure has no skin removed. But if the patient needs to have some skin removed, then we still put these incisions. But the way we place it and the way we suture it, it heals perfectly fine. It becomes almost perfectly invisible.
The procedures now are so advanced and so good, like you can't tell.
You cannot tell. Yes.
You cannot tell.
And the skin-only facelift of the face,
Yeah.
It is something of the
People
past.
think it's like the facelift from like 30 years ago where you look stretched, and it's not at all.
Yeah.
It really is to make you look fresher. And I talked about this because I'm very open. I student TV, so it's very easy to obsess over the way you look. And I had too much filler. And Dr. Sozer did do my surgery, but I love it because what you did was just fresher. It's not that I was trying to look younger, but just fresher.
Yes, I mean crisper.
Crisper, yeah.
And like when you look at the mirror, you want your jawline to be crisp and defined. When you put your head down, you don't want your skin hanging, especially.
I had saggy eyes, and it really bothered me.
Yeah. So I mean, and you're happy?
Oh, I love it.
Yeah.
I love it. I love it. I mean, and you can't tell. And I put my hair back. I would ponytails. No. And I mean, I scar well, and you do have to take care of it. And it is big surgery. Like you have to mentally prepare for it. And you're going to be swollen. Because I think I thought that I was going to come out 10 days. And I'm like, I look fantastic. But you have to give it time to heal, really take care of yourself. Take care of yourself. You have something in your office, which I love, the hyperbaric chamber.
Yeah.
Because I think that sped up my healing.
Yes, it does.
Like crazy.
All the facelift patients now, or any surgery, breast augmentation, tummy tucks, they are in that chamber. They start the day before and the day of, and keep on going, and it accelerates healing. And now, in the past, I used to tell my facelift patient, for example, well, you're not going to be in public for a month. I think nowadays it is shorter. 2 weeks, little makeup, you can get your hair done.
Then.
Yes. And
I mean, I went back to work 1 week later.
Yeah.
Yes.
And I mean, I covered my, I did a little, like.
No, you don't have a facelift. No.
I sleep as a surgeon.
Must be nice to be married to a plastic surgeon.
Yeah, like every night, like, can you fix this?
I know. Marry yourself to a plastic surgeon.
Now you guys see jelly. You guys are making me jelly.
So go keep talking. I didn't mean to keep going. No.
somebody who can afford a plastic surgeon.
I can afford to buy. That's true. Or marry a plastic surgeon. But you were back to work in a week?
In a week, yes. I mean, it was 10 days because I have surgery, let's say, on a Thursday, and I went back to work on a Monday. So, it just balanced. I would say I have 2 facial surgery, actually. I would say that in a month you look good, but the real result, I think that is 6 months later.
Oh, okay.
Yeah, when everything's settled and you see yourself in the mirror, and I say, okay, this is what I want. I mean, the first month, I'm married to a plastic surgeon. I say, what do you do this? What is this like this? And what is this like that? And what I'm gonna do is this.
And then you're not a doctor. Ooh.
No, regardless, I'm like, hello.
No.
Wake up. What were you doing?
It's always a process. A recovery from a breast surgery is much easier. Breast augmentation patients, they are driving the next day.
Okay.
I mean, just put a sports bra, you're on the street.
Yeah.
But face is not like that.
No, it's not. The face wasn't as painful. I'm going to tell you the first time I ever had breasts done, this was years ago. It was so painful. It felt like someone ran over my chest. The face wasn't as painful. It's just, I think, more the swelling and the discomfort and not seeing your face. But you're right. A week after, it's like you're out, and it's exactly what Marilena said. And now I love it. I love it.
Yeah,
And I'm
you both look
52.
great.
I'm 52.
So you mentioned you had 2. Was it the same surgery, but like years later?
No. First I have the neck and a little bit of face, and then
Like a mini lift that,
yeah, but then he didn't do it. My worst part was the neck. I did a lot of outdoor activity around
it looks great
for
now.
so many years. Play tennis. The sun damage was awful. I mean, I have 10 little wrinkles over here. One day I was reading a book and he took my picture on the side, and I'm like, oh. So he convinced me, you need the neck. And then he did a little bit of lift. But then after 5-6 years,
You did what you needed extra.
I mean, the neck was the first step, actually. The first focus was the neck. She didn't want her face to be touched that much at that time. And then when we did the neck looked very good. Later, multiple years later, he said, well, maybe now it is time to concentrate more on my face. So when I did the face, what I did in the neck was so minimal. So what you call like a mini neck tuck. But the first one is more involved, like what we call the deep plane, where you go in there to a deeper structures, reduce salivary glands. It is very highly specialized surgery. Still, not many doctors in the United States perform it. There are still handful. And usually you will get what we call a lateral pull. They will not open your central neck. But if you don't open the central leg, even if you don't go to the deep structures, it will be incomplete or it won't last.
Okay. So earlier you mentioned something about how we start with Botox fillers and then we graduate to surgery, right? So what happens, for example, for somebody that has started working on the fillers and then you decide, okay, it's time to go and get the surgery. What happens to the fillers? Is it a process?
First of all, don't never get permanent fillers, and
that's
just get the fillers that you can dissolve. And when it is time for a facelift, you can inject the enzyme and dissolve it.
Okay.
And you do.
And what's the name of the enzyme?
Hyaluronidase. Because you
It's hyaluronic acid.
You dissolve it.
Yes, yeah, dissolve it, and you do some microfat grafting for volume. And once you get the facelift, it is done right. Yes, fillers, Botox, yes, you should get it, but fillers really not much of a need for several years. But after a while to maintain, you can get little fillers. But I think the lasers, facials, the other things very important. But one thing Botox did, that this procedure you mentioned, became almost not necessary. Everybody has a good forehead.
Yeah. I haven't put on Botox on my forehead because but before surgery, if you were getting Botox before, you don't come to the doctor with a bunch of wrinkles. Yeah, that's right.
So everybody's forehead.
Don't make me frown.
You see, it's very simple.
Yeah, we're like, yeah.
Botox is preventive.
Yeah. And fillers fill, they don't lift. And so when your skin starts to sag, I remember looking at myself in a picture and I was like, I look the pillow face. I look like filler face. I mean,
and then so when you smile, little.
Yes. And my eyes close. I'm like
chipmunk.
That's when, and I remember seeing Maria Elena because we played tennis. And I was like, hey, I need to, what do you think? And she said, go see my husband. And here I am. No, I'm glad I did because you don't realize it till you see yourself in a picture. I guess in the mirror, you don't notice it.
Yes. I mean, they start feeling the nasolabial folds, the jowls and everything. And it just becomes heavier everywhere.
Yes.
And so this, we call it filler exhaustion or filler tiredness. And in some places, in other parts of the world, the permanent fillers are available. And those surgeons over there, they have to deal with it. They go in there and this stuff starts coming out. And the surgery is much more difficult and more risk of complications and everything.
So someone comes into your office, or how soon, if someone's thinking about a facelift, if you're like pulling your face up, you're looking in the mirror and starting to pull up, you may want to consider this. How soon do you tell them to come into your office and start talking to you and looking at options?
I think somebody late 40s, early 50s is a good time to start. Think about like somebody 52-year-old, professionally active, and as we get older professionally, younger people start taking over, although we have the whole experience and everything, but we are looking older. But you have this procedure, if it is done right, really the difference is more than 10 years.
Yeah.
And I have pictures in my office, will prove you, because they bring me pictures of them 25 years ago, and we can almost achieve that. If they bring a picture 10 years ago, it is not looking that good. Like if somebody 60 brings a picture 50 is not looking that great. And we target before that. But let's say you're 52 and you have this surgery, you're looking maybe 38, maybe 40 years old. And these surgeries are life lasting, because that person is never gonna look his or her age, is always gonna look at least 10 years younger.
Yeah. Yeah. That's
Right? And then you start thinking, I'm 52, I can look 40. Why don't I start enjoying it right now? I'm still exercising, I'm still active. I mean, why not hit it right now and wait till 60?
That's right. That's right. And, you know, when we see these celebrity cultures who are like, I just use olive oil, or especially if they're over 40, now that I've had a facelift, I'm like, baloney. They've all had mid-lifts or facelifts. And the techniques right now are so advanced, which is what you do. You go around the world teaching people and talking about it. Tell us about that.
Yes, I mean, I'm part of a society, International Society of Aesthetic Plastic Surgery. I'm on the board of directors. I'm the treasurer right now. I used to be the chair of the education. So I got involved with teaching, and actually we have our own teaching course in El Paso. We did it twice last year. But I go almost 12 different countries a year.
And a Tagalog.
Yes, like in 2 weeks I'll be in Naples, Italy. I'm gonna do a live surgery. I'm gonna operate an Italian lady. I'm gonna do a facelift. It's part of a demonstration. Like around 200 plastic surgeons will watch it. And after that, I go to Georgia. I have some talks over there. After that, I go to Brazil. I do again a facelift in Brazil.
By the way, Georgia, the country.
Georgia, the country, not Georgia. Yeah,
Not
it's,
Georgia.
yes, Georgia is like,
Georgia, the country. Yeah. Eastern Europe, right?
well, actually, it's Asia.
Asia. Oh, yeah.
But it's kind of a European culture.
Yeah.
But it is like next to Iran. That part.
Here's something that you also do. You use the netting, and you don't have drains. And I remember when I had my procedure, you're one of the only doctors, because I looked a lot. I had research that did netting. Almost everyone did drains, like after you get a facelift, you know, to drain all that fluid. But now I see more surgeons using the netting that you use. Have you noticed this shift?
Yes, it increased significantly. So not necessarily they will put the pictures on their Instagram or Facebook or webpage, because those photos can be intimidating.
Yeah.
Or what they do is a limited net. The areas of concern, like blood may accumulate usually in this area, so they put a net only there. But the reason I use net is not only drains, also I can glide the skin. So I can keep my incisions shorter, like this portion, I can glide it back. But when you glide and you don't have an incision, you have to secure this elevation somehow. So you put those outside sutures, and 3 days enough for the skin to be kind of glued into its new position. And then you remove the sutures. Yes, it is not friendly to the eyes. At the beginning, when I start to do it, like if I put it, I got comments like butcher, Frankenstein, and don't go to this doctor. This doctor is crazy. But now,
A lot of doctors.
a lot of doctors use it.
And it doesn't leave marks.
And it doesn't hurt.
It decreases the discomfort. So think about this. The skin is detached because we did surgery, and you move your head, and the muscle and skin, they glide. It's like a fracture. You know, you can splint a fracture. It will be less discomfort. If you secure the skin, you don't have to wear a bandage. You don't have any drains. You can move your head. You can take a shower the next day. Yes, it doesn't look friendly to the eye, but at the end, the results are good. And yes, like some surgeons, they want to show that the result is so visually friendly. They don't show the pictures with the surgical net, but they admit, for example, every male facelift, they will use surgical net, because male facelift tend to bleed a lot. Males have larger faces, it's a larger surface area, and higher rate of complications.
Okay.
So some surgeons will say, I don't put net on females, but I will put net on males. Or they will pick and choose. If the case went a little bit bloody, at the end, they will selectively put a net. But, I put more or less on everybody, but I decrease the amount of net too. In the past, I used to put it everywhere. Now I put it more selective. Now if I post it in the internet, it is more visually friendly.
It goes viral and it gets you followers.
Yes. I think I had like one post-up picture with the net so far, like 20 million views.
Yeah.
Oh, wow.
When you first started doing that.
Crazy numbers.
Yeah.
So we touched on picking the correct board certified plastic surgeon, right?
Yeah.
You mentioned the downtime, recovery time, a lot of the different procedures. How long can the procedure take while you're working on the patient? Is that depending on the patient or approximately?
Actually, I don't think a facelift less than 2 hours will work.
Okay.
Okay. And I am a fast plastic surgeon. I can do a breast augmentation in a matter of 20 minutes.
Wow.
Skin to skin, bilateral. A facelift, I do one facelift a day. If I'm doing upper eyelid, lower eyelid, face, and neck, of course, we elevate the brow all the time. It's 6 hours.
Oh,
At least, because it's so much detail.
yeah.
I find, you don't want
so
it's a
slow
rush.
patient.
And really, it's 6 hours we are there physically.
Perfecting
Placing every single suture from the first minute to the last minute with the same attention. Because at the end of the case, you're closing the skin. Skin closure is very important. You don't want to have crooked incisions and not sutured well. So from the beginning of the case till the last minute, you have to have the same concentration. It really takes physically demanding, but a good facelift over 4 hours, between 4 hours to 6 hours.
Wow.
If you're doing 1.5 hour under local,
No bueno.
it is no bueno.
Yeah. Well, that's interesting. So much to talk about. That's we've been going and going. We're going to have Dr. Sozer back because there's so much to talk about and a lot to ask you. Thank you for joining us. And if you out there have any questions for him or any of the doctors or any of us, please put it in the comments. Thank you for joining us.
Thank you.
Thank you.